Welcome back. This is Dr. Jin Sung. Today is Wednesday. I believe it's around 12:20. I didn't make a video yesterday because I was running late. But today here in New England, we're expecting a big storm. So the schedule is a little lighter and I want to deliver a quality video for you today. And the topic is parasites. Parasites, parasites, parasites. So how many people here in the United States would have a parasite? 1 out of 10, 1 out of 100. What if I told you the likelihood of having a parasite is 8 out of 10? 80 to 85% of people may have a parasite. Okay? So let me tell you a little bit about my office. We use a natural approach that looks at chronic conditions, unexplained conditions or symptoms, or people who have just been given up on. You know, the medical community basically just goes, we don't know what's wrong with you, it just, you know, you need to take an antidepressant. And that's all the answers they have for this type of patients. And it's very frustrating for the patient, and it's very frustrating on my part when I see these patients who come in for our consultations and they literally break down and cry because no one understands what's going on with them. So I'm going to talk about parasites because it's a unexplained type of underlying cause that's really neglected within the medical community. So when we look at people who have chronic conditions, unexplained symptoms, and basically, you know, the basket cases of the medical community, we have to use a different approach. So in our office, we use a three-prong approach using functional medicine, functional neurology, and what I call functional chemistry or biochemistry and toxicology. So we're looking at a patient from what is the source of their problem, underlying problems, like let's say heavy metals or parasites, which is the topic of conversation today. So parasites, studies have shown that about 85% of the people here in the United States has at least one parasite, right? Mind-blowing, right? That many people have parasites. So some of these studies have shown that. So these parasites may or may not give you symptoms initially. So that is the real dilemma, is that sometimes you don't have these symptoms that are characteristic of a parasite. So most people think of parasite, they think about diarrhea, constipation, throwing up, and those types of things. Of the parasites, of 85% of people who might have it, 70% are microscopic, so you can't see them. You can't visually see the parasitic infection. Only about 30% are visible. So you can actually see it in the stool, right, when you have a bowel movement. And I have quite a number of patients who tell me they see parasites in the stool when they had the bowel movements, when we do some remedies for them. Okay? So if you look at the parasites and what it does to the human population, if you took all the wars throughout history and the number of people who were killed during the war, right? Parasites kill more people than all the wars combined. And that's according to the National Geographic, right? So when we look at it, when we have things you can't see that's affecting us, then we have to be suspicious when we have patients who come in and they don't know why they have these symptoms or why they're sick, why they're fatigued. They just don't know why. And no one can give them the answers. And the answer might be parasites. So the top 3 reasons, or top 3 indicators that you may have a parasite is 1, chronic digestive issues. Chronic issues in terms of reflux disease, digestion problems, constipation, loose stool, a lot of bloating and gas. That can be one sign. Number 2 is mental distress, anxiety, depression, seizures, cognitive decline, sometimes things like Alzheimer's, maybe a parasitic infection, maybe it might be Lyme's that's affecting the brain. So autoimmune disease is another indicator. So the top 3 indicators might be chronic digestive problems, mental distress, and autoimmune disease. Autoimmune disease like rheumatoid arthritis, Hashimoto's thyroiditis, right? If you don't have any of these types of symptoms, then you have to look at what other symptoms might you have if you have a parasitic infection. One might be food cravings, right? Where you always hungry all the time. Or you might have skin irritation. Or you have anemia. Basically, parasites love iron. It'll suck up your iron store and you'll get a low-grade type of anemia where you're not full-blown iron deficiency, but you tend to run low and you're always tired. So anemia is an indication that you might have a parasitic infection, especially in the GI tract. Recurrent yeast infections, headaches, or restless leg or restlessness, like you never feel like you can stay calm. Or the person who grinds their teeth at night. Sometimes that grinding is an indication of a parasite. Unexplained itching, joint pain, or multiple migrating joint pain, right? Those are all different signs and symptoms of someone who might have a parasite. Now, if you go to the traditional medical route, all these signs and symptoms that I just talked about, they're just going to say, oh, you have a headache, here's the medication. Oh, you have anemia, here's take some iron. Oh, you're grinding your teeth, how about an appliance so you don't grind your teeth or you don't break your teeth, right? It's all symptom-based. But if you look at it, it could be an underlying cause of a parasitic infection, right? So what are the top causes for you that makes you susceptible for an infection? One is a immune weakening or weakened immune system, right? Because we are under such toxic load, right? Stresses like physical, emotional stress, chemicals, heavy metals, pollution, right? Foods, GMO foods, food coloring. It decimates the gut lining and it weakens our immune system because a good chunk of your immune system is in your GI tract, right? We run a secretory IgA on a lot of people to look at the immune system of the GI tract because that's very important. So we're looking at immune weakening due to toxic load, chronic stress, genetic predispositions, and autoimmune disease. Those all can affect how our immune system functions. So if we can boost our immune system, get it healthier, you have a greater chance or probability of fighting off parasitic infections, right? So why do we get them? I mean, you think about it. You go out and you have your dog and you're running around in the park and there's other dogs there and they're pooping on the ground and you're walking there with your sandals, walking and kicking up dried up fecal matter. There can be spores. There can be eggs in there and you're breathing it right in, right? And your dog goes and licks things, right? And then you let the dog lick your face, your eyes, your nose, your mouth, right? That's a mode of transmission. You got to look at those things. Food, right? Properly not washing your foods. Water sources. You need to have a water filtration system in your house. Swimming in lakes and beaches that are polluted, you can get infested with parasites. So there's a lot of different types of parasites when we look at this, right? There's tapeworms, hookworms, giardia, flukes or liver flukes, pinworms, roundworms, amoebas, protozoans. There are a lot of different types of parasitic infections, right? And we are blind to it because we don't know why we have all these symptoms. In our office, we run a comprehensive genetic or DNA probe of the stool to look at your good bacteria, bad bacteria, your protozoan infections, amoeba infections, your hookworms, roundworms, your secretory IgA, gluten. There's a fantastic stool test that can pick up a lot of these things. And if we can't pick it up on that, it might be some energetic type of medicine that might pick it up, right? We use a form called field control therapy to help us narrow things down if we can't find it on traditional lab tests. Because lab tests will miss the whole picture sometimes. We like to use advanced testing to figure out things, but we don't always catch it on that. That's where other things might come in terms of energetic medicine that might help with patients like that, right? But if you went and did a parasitic cleanse maybe once a year, despite if you have a symptom or not, it might be of benefit for you, right? In a lot of countries, especially in Asia where they have a lot of raw fish, they do a parasitic cleanse like once a year, twice a year. They use a medication and they just do it because they know it's a very common thing when you eat raw foods. So food exposures, contaminated meats, and so forth. Here in the United States, it's not a common thing to do a parasite cleanse or a parasite medication. It's just not common. But yet, it can create a lot of different symptoms for a lot of different people, depending on their immune system and if it's weak or not. So, what kind of herbs can we use to eradicate some of these parasites or knock it down before it becomes a problem? So some herbs are like black walnut, fennel, wormwood, which is a good one, cloves, garlic, ginger, berberine, cayenne, oregano. We use a great product that's a slow-release oregano that can help get down into the lower GI and eradicate some of these infections. Olive extract, right? So there's a lot of them, and a lot of these parasitic cleanses come not just as individual herbs, but as a combination. So it gives you a amplified effect, where instead of using one herb, you use 2 or 3, and the effect can be stronger than using one herb at a time. So using multiple herbs in combination can be a great way of eradicating parasites. But once you eradicate them, you still got to heal the gut, right? You have to heal the gut, otherwise symptoms will come back, or you can get recontaminated because your immune system is still weak. So you have to build the GI tract, you have to build the immune system so these things do not come back, right? I myself, I don't have any symptoms, yet I do a parasite cleanse probably once a year, sometimes twice, just to ensure that I don't get an overgrowth of these organisms that are very prevalent, right? It's very, very prevalent. It's just being missed within the medical community. And you need to know, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And we'll see you next week on the healthy side. All right? Have a great day.